Actually, every person with Parkinson's might have some degree of gastrointestinal dysfunction. The entire gastrointestinal tract can be affected from the mouth to the rectum. And we know now that there are several mechanisms that can explain these gastrointestinal symptoms and disturbances. Among them, alteration of the gut microbiota, this pool of bacteria, protozoa, viruses which live in our gastrointestinal tract. We know now that people with Parkinson, they have an altered gut microbiota compared to people without this condition. And the alterations, they seem to suggest pro-inflammatory changes. So a situation that can trigger inflammation and potentially also facilitate alpha-synuclein aggregation, which is, as we know, involved in the pathogenesis of Parkinson's disease and can be also found in the enteric nervous system at the level of the gastrointestinal tract. So over the last decade, several studies have showed these changes in the gut microbiota of people with Parkinson, and this has set the ground for the use of gut microbiota modulating interventions such as probiotics or fecal microbiota transplantations for the treatment of Parkinson's disease. And among the different clinical manifestations of gastrointestinal dysfunction in Parkinson's disease, we have dysphagia, we have delayed gastric emptying, we have constipation. For instance, we know that constipation is one of the prodromal features of the disease and is also a risk factor for the development of the condition. So this highlights the importance of the gastrointestinal tract in Parkinson's disease. These symptoms are prevalent, are common, they are troublesome for the patients, and they can also precede the onset of motor symptoms. And from a pathological point of view, we know that the alpha-synuclein aggregations, pathological aggregations, can be found in the enteric nervous system, which is essentially the so-called second brain, because there are several neurons at the level of this enteric nervous system, and in people with Parkinson's, post-mortem studies have showed the presence of pathological aggregations of alpha-synuclein in the enteric nervous system of people with Parkinson's disease.